So going over a fishbone diagram, one of the first steps after we realize there's a problem, you're going to look at the different categories, different areas of where problem areas occurred, where they need attention to look at. In this situation, we're looking at there's people, equipment, processes, environment, materials, and management. So just starting off with people, looking at nurses or even the patients. Nurses constantly are distracted. As a nurse, they're in a new role, a new grad nurse. So you're got a lot of things going. You're adjusting, orienting to the unit, trying to manage everything. You're often tunnel vision, but you're trying to just grasp everything and learn as we go. So a lot of stress in that situation. The equipment in our emergency department, there's no scanning capabilities, like I mentioned earlier. You grab the medication for the Pyxis or the supply room, which means there's no scanning whatsoever or coding. You just got to do your due diligence, check the medication. When you grab from the Pyxis, you're double checking before you administer. We always look at that. I have a rigorous thing where I always write down my medications before I even go pull them. I still write down the dosage, the rate, just because I'm still getting familiar with a lot of these meds. Even when I have a preceptor that says, "Hey, you don't need to write it down," I'm like, "Yeah, I need to write it down." That's just my thing. The processes. We're looking at. I didn't visually confirm the medication order. I didn't look through the system. I didn't see it. Even if I didn't write it down, which I still like to, I didn't visually confirm that was the right order. And there's no way to catch it. Maybe it was the right order, maybe it was the wrong medication. I didn't do anything. I didn't do my part in that. There was no second check by the preceptor verifying. Okay, you know what? You went through the process. You did this. So that was not done. And when we go to environment, we're looking at medication routine interrupted. So just that's a constant thing. You're never actually. Sometimes something else comes up. You got to pause. You got to go back. You got to go to another room. We get codes coming in. Oh nope, it's your patient. You're getting that bed. It's just a fast-paced environment. Going over to materials. So the lactated ringer bag and the normal saline bags, they look identical. So that's something I think that's from my experience. It's every hospital. I don't think there's any vendor or someone that decided or did something different, and I don't know if they ever will. But I think that's something that's a common issue, especially when we go to the supply room all the time. Just even coming out shift right now, there was lactated ringers in the spot where the normal saline is. They're 1,000 cc bag, and it's right there. So it's like if you don't double check, you could inadvertently grab the wrong bag, and that's an issue. And when you're running it, there's no label on that medication. That's something usually, especially when you mix medications, I always put a label on it, put the rate and what it is that's in there. But in these, the practice is you grab the LR and you just go by whatever the rate is prescribed. So in this one, there's no label on it. So there's no way to double check or verify, oh, is this the right rate? Are we doing it right? And in management, just a lot of times there's budget constraints. So we're using older equipment. We're kind of stuck with what our budget is, what we could spend, what we have on board. That's kind of what we're dealing with. And that all kind of led to the medication. Those are all, ultimately it was, it's going to be decided later, the greater faults, but all these little things had to play a part in it.